Medtronic has developed a full range of infusion sets and reservoirs especially for your Paradigm Veo. Whichever one you choose, it's important to change it every 2 to 3 days to optimize the effectiveness of your therapy and reduce the risk of infection. In this section, you'll need your Paradigm reservoir, a Paradigm infusion set, an infusion set insertion aid if required, and your insulin. There are 3 main infusion sets to choose from: Quick Set, Silhouette, and Sure T. Let's take a look at all 3. The Quick Set offers a soft cannula set inserted at a 90-degree angle, a quick-serter insertion device for consistent insertion depth, at-site tubing disconnection. You may like the Quick Set if you are of average to heavy build. The Silhouette offers a soft cannula set inserted at a 20 to 45-degree angle, the Sil-serter insertion device for controlled insertion depth, at-site tubing disconnection. The Silhouette may be a good choice for babies, pregnant women, or lean adults and children. Finally, the Sure T offers a steel cannula set inserted at a 90-degree angle, tubing disconnection 10 centimeters from infusion site. Sure T is ideal for children of normal to heavier build, pregnant women, and those allergic to Teflon. Despite their many differences, all 3 infusion sets have one element in common: the Paradigm connection. The Paradigm connection is a unique interface between your Minimed Paradigm infusion set and reservoir, carefully designed to be secure, reliable, and easy to use. Here are a few tips for inserting the infusion set. First, thoroughly wash your hands. Next, cleanse your insertion site prior to insertion. Prepare the materials you need, including insulin, reservoir, infusion set, and pump. Make sure insulin is at room temperature. Stand while inserting. Insert your new infusion set before removing the old one. Choose an insertion site free of lumps, bumps, bruises, tattoos, scars, or infection. Cleanse your insertion aid each month with an alcohol wipe. Dispose of introducer needle, transfer guard, and old tubing in the sharps container. Never change your infusion set before going to bed. Check your blood glucose 2 hours after you have changed the infusion set. When filling a reservoir, you first need to cleanse the rubber stopper on the insulin vial with an alcohol wipe. Wait 1 minute for the alcohol to dry. Next, insert the needle of the transfer guard into the vial until it snaps into place. Hold the insulin vial in one hand and press the plunger, allowing air to enter the vial. Invert the reservoir and allow it to fill, gently pulling on the plunger if necessary. Gently tap on the reservoir to remove any bubbles. Remove the transfer guard from the reservoir by turning it 1/4 of a turn. Then connect the reservoir to the infusion set. Push up on the plunger until you see insulin entering the tubing. Finally, unscrew the reservoir plunger. Your Minimed Paradigm reservoir is now ready for insertion into your Paradigm Veo. Here are some guidelines for using the quickset. First, place the quickset into the quickserter while holding the needle protector. Remove the protective film from the adhesive and load the quickserter by pulling back on the plunger. Remove the needle protector by gently unscrewing it. Position the quickserter at your desired site, pulling the skin taut. Squeeze the 2 white buttons to begin the insertion. Press the plunger with your index finger to release the introducer needle. Gently remove the quickserter while supporting the tubing with your other hand. Carefully withdraw the introducer needle by pulling it straight out. Fold it and place it in a sharps container. Then rub adhesive onto the skin. To fill the cannula, use 0.3 units of insulin for the 6 mm quickset and 0.5 units of insulin for the 9 mm quickset. Here are some guidelines for using the silhouette. First, open the mouth of the silhouette by pressing on the round button. Place the silhouette into the silhouette and then release the mouth by removing your finger from the round button. Remove the needle protector and the top half of the protective film from the adhesive. Load the silhouette until you hear a click. Place the feet of the silhouette onto the insertion site, making sure the skin is pulled taut. Position the silhouette so that it is at a 30-degree angle. Insert the silhouette by pressing on the white button. Open the silhouette mouth, then slide the silhouette backwards away from the infusion set. Withdraw the introducer needle by pressing on the sides, then gently pull it away from the silhouette. Place the introducer needle in a sharps container. Remove the other half of the protective film from the adhesive and affix the silhouette to the skin by rubbing on the adhesive. Connect the tubing to the silhouette and fill the cannula with 0.7 units of insulin for both the 13 and 17 mm sets. When filling your infusion set tubing and cannula, make sure you follow these steps. To fill the quickset and silhouette, be sure that after inserting the infusion set, you are disconnected. Fill the tubing first. After filling the tubing, connect the infusion set and fill the cannula. To fill the Sure-T, fill the entire infusion set and needle before inserting the infusion set. After filling the needle and tubing, insert the infusion set manually. To fill your tubing and cannula or needle with insulin, follow these steps. First, press the Act button on your Paradigm Veo. Scroll down to Reservoir and Set and press Act. Reservoir Setup will be highlighted, so press Act again. The paradigm valve is now prepared to rewind the piston. First, remove your reservoir from the pump and then press Act to rewind. Once the rewind is complete, the screen will display Rewind Complete. At this point, you are ready to insert your new reservoir with insulin into the paradigm valve. To do so, insert the reservoir into the pump compartment and gently turn the reservoir a quarter of a turn to lock. Press Act. You are now prepared to fill your infusion set tubing with insulin. First, make sure you are disconnected from your infusion set. After doing this, highlight Yes and then press Act. To fill the tubing with insulin, hold the Act button down continuously until you see insulin drops coming out of the end of the infusion set tubing. Once you have seen that drops are coming out, press Escape. Do you see drops at the end of the tubing? Highlight Yes, then press Act. For the Quickset and Silhouette infusion set, you will now need to fill the cannula. Please note that if you are using the Sure-T steel cannula set, you will skip this step. First, press Act to enter the Fill Cannula menu. Please be sure to adjust the amount of insulin needed to fill your cannula by using the up and down arrows to adjust the insulin units. Once you have selected the units of insulin needed to fill the cannula, press Act. Once the paradigm valve has completed filling the cannula, press Act.